So basically, the nervous system receives stimuli from the outside and inside the body and interprets stimuli and initiates a response for survival. Here we can see the difference between the CNS and the peripheral nervous system, which controls thoughts, voluntary actions, and the five senses. The brainstem, which is located at the base of the brain and controls vital and voluntary processes such as breathing, for example, and digestion. Then we have the spinal cord, which is basically a bundle of nerves that begins at the brainstem and continues down to the center of the back through the vertebrae, and it connects with the peripheral nerves. Basically, for today's video, we'll basically be talking about the nervous system and disorders that are comprised from the nervous system. So basically, we're going to first discuss what is the nervous system. So the nervous system is basically a complex system that regulates and coordinates bodily activities, and it's made up of two components, which would be the central nervous system and the peripheral nervous system. So this is basically a breakdown of disorders and degenerative disorders like Parkinson's disease, Alzheimer's disease. So with the nervous system being vulnerable to so many things, this can be things such as vascular disorders. When we talk about vascular disorders, we talk about strokes, ischemic attacks, subdural hemorrhage, subarachnoid hemorrhage, extradural hemorrhage. Then when we talk about degeneration, we talk about things such as Alzheimer's, Parkinson's disease, and then with functional disorders, we can refer to any like brain or spinal cord injuries. With infections, we can refer to things such as meningitis, myelitis, and then disorders we can refer to things such as neuralgia. And then with structural disorders, we're looking at things such as brain or spinal cord injuries, carpal syndrome, cervical spondylosis as well. When we talk about autoimmune or inflammatory disorders, we're talking about Bell's palsy, or things such as multiple sclerosis can be examples. So these are all basically examples of like what we're referring to when we say that certain disorders can lead up to problems with the nervous system. Just common symptoms and signs when we're looking at nervous system disorders can be things such as persistent headaches or a sudden onset of a headache that changes or kind of differs. So, for example, this can be in pain level or in location. For example, loss of feeling or tingling sensation, or if they've lost muscle strength or they have weakness. This can also be signs of a nervous system disorder, as well as many other things such as loss of sight or double vision, which we know double vision basically seeing two objects at the same time, and things such as memory loss. Impaired mental ability, for example, is very hard. It's harder for the person to learn and comprehend certain things and remember things as well. This can be also a sign, as well as lack of coordination. And this we can use using Gates and Romberg's test, which I will elaborate later on in the video what that is exactly. But it's basically a test showing coordination and trying to observe balance in a patient, as well as muscle rigidity. So, for example, if their muscle is stiff, which makes it difficult to move, this would be an example of muscle rigidity, and tremors and seizures. So, in the hand, for example, like when there's a shaking of like hand or anything like that, for example, which I'll observe later, and then back pain that often radiates to the toes or feet as well could be another example, as well as slurred speech, and also as well as lack of comprehension expressibility. So basically, when the patient is unable to express themselves or comprehend or able to make and articulate a complete sentence, this can show that there may be signs in terms of the neurology and their nerves.
Hi, how are you? Hi, I'm good, thanks. And how are you? I'm good, thank you. So basically, my name is Karabo, and I will be your nursing assistant for today. So basically, I heard that you're having some problems. Is that correct? Yeah. I've been having like headaches. It was like here and then sometimes here. I don't know. Okay, so basically, your headaches have changed over time. So they started here and then they went to the back of your head. Okay. And how often does it happen?
Quite often.
Okay. And then do you struggle to pick up some things? Like, have you lost some strength? Do you feel weak?
Yeah, sometimes.
Okay. And then how is your sight? Are you able to see clearly?
No. I sometimes struggle to see, like.
Okay, so do you have double vision?
Yeah.
Okay. And then how do you find that you often tend to forget things sometimes?
Yeah, sometimes.
Okay. Alright. And then does your muscles feel any stiff? Like, do they feel stiff sometimes?
Mm-hmm.
Do they feel stiff?
Yeah.
Okay, and how long has that been happening?
For about a week or so.
Mm-hmm.
Yeah.
Okay, then.
Yeah.
Okay, so I'm gonna ask you to do a quick test for me. Is that okay? Okay, so first I want you to do this, and then this. Okay? And I want you to do this for 10 seconds. Okay?
Okay, I can't do this.
Do you wanna stop?
Mm-hmm.
Okay. Stop. Some of these tests would include walking in just a straight line, trying to observe balance, or walking from heel to heel if the patient is able to.